Now, your stories, your struggles, and your successes. This is Focus on South Florida.
Good Sunday morning, everyone, and welcome to Focus on South Florida. I'm CBS 4's Chief Investigative Reporter, Michelle Gillen. We begin today with a question. How big is the problem of Alzheimer's disease? The facts and figures are startling. More than 5 million people are living with the disease. Every 67 seconds, someone in the United States develops Alzheimer's. 1 in 3 seniors dies with Alzheimer's or another form of dementia. And according to ALZ.org, Alzheimer's prevalence in Florida will increase from 49% to 81% between now and 2045. But 2 recent studies are providing encouraging news for our senior citizens and all of us, and particularly those of us with parents reaching the elderly stages of their lives. Joining us this Sunday morning with details that can help you and your loved ones stay sharp is South Florida neurosurgeon, anti-aging specialist, and author, Dr. Brett Osborn. Welcome, doctor.
Thank you.
This is such a fascinating area. Now, I'm fascinated because you're a neurosurgeon. When you actually operate on a brain, can you see the signs of Alzheimer's?
You cannot see the intrinsic signs, the microscopic signs of Alzheimer's disease. What you can see, however, is the fact that the brain is markedly atrophic or shrunken as a result of the neurodegenerative process.
Yes. So what then made you say, aside from doing my surgeries, I really want to look at what we can do to identify any forms of prevention?
Well, what I preach to my patients is the following. In addition to addressing the primary problem, say it's a degenerative disease of the spine,
yes,
what we have to remember is that exercise affects all areas of the body. It's not just the fact that we're exercising to increase the size of our muscles, to make ourselves stronger.
Yes.
That's sort of a side effect of exercise.
Yes.
What we're doing primarily, you have to understand, is exercising our brain, because our muscles are simply offshoots. They're extensions, if you will, of our nervous system. Without the will to make your muscles move, to move that weight, to run the 5 miles, there is no exercise. So it's all generated here. And this is what confers the salubrious, the benefits, the health benefits of exercise.
Now, do you see that folks who are even in their later years, who maybe were not, because, you know, the older, that generation didn't exercise like we do. Well, I can say like you do, because you're in amazing form, you know, but do you feel it's critical for people who are already even in their 80s to do some type of exercise? Is it possible to slow the development of dementia and ultimately Alzheimer's?
Yes, exercise is really the prescription for everyone, regardless of age.
Yes.
You have to remember that despite the fact that you may be 70, 80, 90 years old, the human body was really made to exercise, to carry rocks, if you will, to run, to sprint. And this is what confers the beneficial effects on the brain. The fact that we are stressing our bodies, challenging our bodies, even into our later years, we do have the hormonal support to be able to generate that muscle. And the fact is that when we're trying, the process of generating that muscle, when we're trying to generate that muscle, that challenge, that stimulus is what confers the beneficial effects on the brain. Now, there were 2 studies, as you had mentioned previously, that spoke about the benefits, or addressed the benefits of exercise on the brain. Even in patients that are genetically predisposed to Alzheimer's disease, genetically predisposed, the memory hub of the brain, which is called the hippocampus.
Right in the back here, right?
It's in the temporal lobe, so it's sort of towards the middle, straight in here.
Gotcha.
The decrease in size, the 3% decrease in size that we see in patients that are genetically predisposed to Alzheimer's disease is thwarted in the context of exercise. So there was no decrease in size in the individuals that were exercising, even though they had genetic predisposition to Alzheimer's disease.
That's amazing.
It is.
And that is the area of the brain, well, I'm not getting the location right, but isn't that the area of the brain that also can deal with our empathy and certain emotions that we deal with?
That is correct.
Because we often kid that, you know, as our parents get older, sometimes they have no filters anymore. They just say what they want and, you know, take it or leave it.
Right. There are some emotional centers that are localized to the temporal lobe as well.
Yes.
But also these issues that you had discussed, that's a frontal lobe function, which is also, interestingly, to some degree responsible for our memory.
Wow. You know, I've been looking at Alzheimer's and covering stories for years, and I got a letter the other day from a woman that I did a story on her. She had early onset, and I want to talk a bit about how we're seeing earlier ages. She wrote me this beautiful letter the other day. She decided to change her life when she was diagnosed, and she totally changed her job. She cut out her stress. She fell in love. She's living in, you know, another part of Florida. She wrote me a letter the other day saying she's doing unbelievable. She does brain exercises every day, which we can talk about, and she says, I'm living proof to show that if you exercise, if you meditate, if you really take care of this temple, you can even slow down something like Alzheimer's. It just brought me such joy to read that letter.
And that is absolutely correct. The most important thing that we can do to thwart the degenerative process, the neurodegenerative process, and Alzheimer's disease is a neurodegenerative disease.
Yes.
The most important thing one can do is exercise. It has anti-inflammatory properties.
Yes.
As you know, Alzheimer's is an inflammatory disease, like cancer, diabetes, cerebrovascular disease, coronary artery disease. These are all inflammatory disease. Exercise confers anti-inflammatory effects. It increases the production, the synthesis of what's called BDNF, brain-derived neurotrophic factor, which is a fancy name for a chemical that increases interneuronal, so nerve-to-nerve connectivity.
Yes.
Exercise increases cerebral blood flow, so it washes away the toxins that accumulate during normal routine activities, and a whole host of other protective effects that exercise confers on the brain.
So I want to tell everybody, so your book is called Get Serious. And this is fantastic, A Neurosurgeon's Guide to Optimal Health and Fitness. And, you know, if folks want to invite you to their places, because, I mean, you'd be an amazing speaker for folks of all ages, you know, what's the best way for them to get in touch with you?
They can get in touch with me through EMSI, who does my public relations. They are a PR firm that's located in Tampa. And the contact person there is either Marsha or Steve Friedman.
And your book, how do we find your book?
You find the book at www.drbretosborn.com.
Fantastic.
And you can be routed through my to my PR people that way as well.
Wonderful. Well, I love it all, and I see here you're talking about green tea. You know, we just did a whole thing there on trying to prevent breast cancer with a Dr. Christine Horner recently, and I think, you know, this is of our time where we know these things. Give me a last message of how you want to say to people, wake up and start doing them.
Just remember that a rolling stone gathers no moss. So
keep moving.
That's right. Keep moving. Get serious about your health, because there's nothing that's more important.
Fantastic. Great advice. Doctor, it's such a pleasure to meet you. I could talk to you for more than an hour, and I'm sure we'll have you back again.
Thanks for having me.
Keep on. Thank you.